Good afternoon, everyone, and welcome to the National Council of Urban Indian Health Accreditation, Preparation, and Best Practices Community of Learning. Today's session is featuring the Commission on Accreditation of Rehabilitation Facilities, CARF, and we'd ask you to enter your name, organization, position, and tribal affiliation in the chat box as you enter. We'll give you a few moments to get settled in and of course be respectful of your time. We're scheduled for a 90-minute session today from 1 to 2:30 p.m. So fasten your seatbelts and we'll start in a few moments. Again, good afternoon, everyone, or good morning. Thank you, everyone. Let's go ahead and get started. Should we have our next slide, please? Again, this is part of a community of learning series. We have 4 sessions in our series. This is our 3rd session, April 8th. The series title is Standards, Preparations, and Best Practices for Accreditation. And our 4th and final session will be April 22nd. Next slide, please. Today's agenda is straightforward. We'll give you a little bit of information about Nikui. We'll give a little bit of housekeeping tips about Zoom, share the evaluation link with you, and without much further ado, introduce our presenters and then hand off the baton to today's speakers. Next slide, please. As stated, your feedback is very important to us. Without your input, we wouldn't know what topics and concerns are emerging out there. So your survey feedback is really vital for us. We'll have a link that we'll share with you from time to time and invite you to complete that survey link at the end of today's session. It'll be pasted in the chat as well as available to you further in the slide presentation. So don't forget to take our survey. Again, you'll be directed to the survey. It takes about 4 or 5 minutes for you to complete, so it's not a heavy lift. And we just encourage you to please complete that for us. Next slide, please. Nikui is the national nonprofit organization devoted to the support and development of quality, accessible, and culturally competent health and public health services for American Indians and Alaskan Natives living in urban areas. Nikui is the only national representative of 41 Title V urban Indian organizations, UIOs, chartered under the Indian Health Service Act and the Indian Healthcare Improvement. Nikui strives to improve the health of the over 70% of American Indians and Alaska Native populations that live in urban areas and supported by these quality, accessible health centers. Next slide, please. A little bit of housekeeping. This webinar is being recorded. Your mics have been muted unless it's otherwise indicated, and we'd ask you to please turn your camera on so that we can maximize the interaction amongst our audience today. Today's session is a 90-minute session. Throughout the session, you'll be able to type questions or comments into the chat box, and we'll carefully monitor your questions. A Q&A session will be offered throughout the sessions and towards the end of the session as well. So there'll be ample opportunities to have your questions addressed. Again, the particular session will be available to you shortly after this session ends via our landing page shown in the link above, and the slides and recordings will also be disseminated to our audience, our participants following this presentation. Again, a reminder, the evaluation at the end of the session is really important to us, and we strongly encourage you to provide feedback. Next slide, please. For those of you unfamiliar with Zoom, a little bit of information about how to ask your questions. At the bottom of your screen, you'll see icons that allow you to enter the chat. You can select the chat feature or the reaction feature to indicate reactions. Reactions would simulate raising hands and so forth. Throughout the conversation, again, the chat feature will be open to you. You can type your question anytime. We'll monitor the chat and make sure that we'll alert our presenters so that we'll be able to address your questions throughout. Next slide, please. Today's presenters, and I'm going to offer a brief bio of each. Michael Johnson is currently the Managing Director for the Behavioral Health at CARF International. Excuse me. The role he's held since 2013. In this role, Michael is responsible for the development of standards in behavioral health to maintain currency with the field, interfaces with regulatory entities and payers, consultation and training, and market development. Michael has more than 40 years of experience in the behavioral healthcare field. He began his career in behavioral health as a tech on a psychiatric inpatient unit in 1981, and since that time has worked in a variety of clinical, management, and C-level roles in both mental health and substance abuse agencies. He's been a leader in the industry, providing expertise to national and state initiatives in quality, ethics, training, accreditation, and EMR adoption. Michael is passionate about the use of data and technology in our industry and is a tireless advocate for increasing performance in behavioral health. He possesses a Master of Arts degree in communications and a Bachelor of Arts degree in interpersonal communications from the University of Central Florida and is a certified addictions professional. Michael Johnson will be our first presenter. Our second presenter is Dustin Richardson. Dustin Tye Richardson is a licensed professional clinical counselor with a background focused on severe and persistent psychopathology, as well as trauma. He has over a decade of experience working in public mental health in a variety of settings that include residential, inpatient, outpatient, community, and crisis. He serves as the clinical director of Native American Lifelines in Baltimore. Ladies and gentlemen, those are our presenters for today. Without further ado, I'm going to hand the baton to Michael so we can get underway, and I hope you'll get a lot from today's presentation.
Thank you, Mark. It's certainly my pleasure to have the opportunity to be able to be here with you today. I very much value this opportunity to share with you some information about CARF and answer any of the questions that you may have. I'm going to really try to talk about this through the lens of the value of accreditation. I think there's no way to avoid talking about, CARF, as that's certainly the organization that I work for, but really I want to kind of talk about what accreditation does and what it's supposed to do for an organization. As Mark has already introduced me, I don't need to do any more. Thank you so much for that wonderful introduction, Mark. I think that as a starting point, when you think about like, why would you even need to do anything when it comes to whether it's talking about accreditation or whether it is working towards other types of recognitions. The primary reason that we do this, aside from the fact that we are wanting to be able to demonstrate quality, we need to do this just as a function of being able to attract, retain, and provide quality care to individuals that we seek to serve. People are, there's a lot of drivers that force people into different providers. Some of them may be because it's payer driven, some may be around groupings that make sense, or location and that kind of stuff. But when you talk to individuals who are seeking services in the area of healthcare, they are hoping to get the highest quality, and they're looking for opportunities to be able to be assured that the provider of service to them is a quality provider. And certainly accreditation is a mechanism to help to ensure that. Now, there's a variety of different things that we sort of in the accreditation business call recognitions around quality, and those things might be things like licensure, certification, and accreditation. But each of those is really different. And so I wanted to take a moment to explain what those different functions are, because a lot of times people want to use those languages or that language interchangeably, and they really aren't interchangeable. They really are different things. So first, if we talk about certification, certification generally is something that is achieved by individuals, right? So an individual may be certified to provide a specific type of service. Sometimes a program might be certified. There might be a certification that a program has where there is a professional organization that has somehow validated perhaps fidelity to a particular evidence-based practice or to particular criteria. But that is something that is generally real narrow and specific to a function, like I say, as an individual or as a program, whereas licensing is generally a governmental function. It is something that a state or other regulatory entity offers. And generally what that licensing function is designed to do is to protect the public or the people that are entrusted by that regulator. So oftentimes I'll have people say something to me like, well, we're licensed, which means that we're a quality organization. And I'm not trying to certainly take away from the function of licensing, but what licensing is really designed to do is to protect the public. It's really a public safety measure. It's not designed to be a quality measure. So they really set the floor, effectively saying that at a minimum, organizations have to be able to demonstrate A, B, and C just in order to be in business. And those regulations are designed, again, to just protect the safety of the public and not necessarily designed to drive quality. And that licensing review, for instance, is the same typically over and over and over again, right? You're probably familiar with that function where perhaps annually the state comes in, they have the same regulations that they had last year, and they check those things and ensure that there hasn't been any slippage in any of those areas in order to be able to grant that license. Those licensing rules don't change very much. Accreditation is typically a voluntary activity that an organization that is an independent body comes in and actually applies a set of their standards within the organization to be able to determine whether or not there is evidence of quality performance by that particular entity. Now, I say it's primarily voluntary because it's not always voluntary. There are some places where accreditation is being mandated. It may be mandated in order to participate in a particular financing system. Some states, for instance, in order to be able to bill Medicaid, you must be accredited. There is one state in the country, Maryland, where in order to become licensed, you must be accredited. So you can't actually get that license unless you are already accredited. So what is it? Accreditation at its core is simply a quality improvement function. And Noelle, you took back control.
Oh, I'm so sorry. I was trying to admit someone.
No worries.
Apologies. Let me get that back to you.
Apologize for this, folks. I guess we're all sort of in that place now where we're having to get used to doing things quite differently than we did in the past, right?
There you go, Michael.
Yeah, thanks. So accreditation at its core is really a quality improvement function, right? It seems like sometimes people want to describe accreditation as that seal or that certificate that's on the wall. And although that's an output from accreditation, what all accrediting bodies try to do is get an organization to implement sort of ongoing systems of quality, and then that is being verified externally through in our case, a consultative on-site survey process that is designed to function or designed to ensure accountability in efficiency, satisfaction, access to services, as well as monitoring the conformance to our standards in particular service delivery program areas that are designed to say that, you know, these are the factors that represent quality in those particular functions or those particular programs. And the value of accreditation for an organization is, you know, multifold. First, there's around business strategy and improvement. You know, it's easy, I think, for an organization that is not accredited to be able to, and probably legitimately say that, you know, we're a good organization, we provide solid services, et cetera. And that very well could be true. But it almost is as if you don't know what you don't know if you haven't been through the accreditation process. And I don't mean that to sound in any way, you know, like condescending or arrogant or anything like that. It's just that it is unusual for programs that are not having to be measured externally to focus on implementing systems around like all of their business strategy areas. They may be meeting legal requirements, and again, that sort of sits at that licensing level, but it is not typical that organizations are going to implement significant systems of managing risks and looking at things like how to plan for the acquisition and the implementation of technology, how to have, you know, consistent health and safety practices, et cetera. And all of that business strategy and improvement activities really is going to take the organization farther in its own self-analysis. And then ultimately, and I'm going to show you later, that there's typically results that come along with that. There's certainly service excellence because of those standards, as I said, that you're being compared to externally, right? You're able to demonstrate that, yes, we are meeting all of these standards of service excellence, which is going to ensure that we are staying current with the field, that we are implementing the kinds of processes and measuring outcomes that is reflective of a high quality, high functioning organization. There's also simply accountability, being able to demonstrate to all stakeholders, that could be board members, it could be a tribal organization, it could be other regulatory bodies, that we already meet these level or meet this level of performance as an organization, and you're demonstrating you know, that accountability to the individuals that you serve, that you are wanting to show them that you are providing high quality services. A lot of the standards that are written really for all accrediting bodies are designed to help you to mitigate risks, right? We're wanting you to reduce any risks of harm, both to the individuals that are being served in the programs, as well as the program or the organization itself. So a lot of those standards are written as a way to protect the organization from potential loss, injury, et cetera. And then lastly, here in sort of a global area is competitive differentiation. As I said in the first slide, if an individual is looking for quality and they have a choice between two organizations and they're trying to decide, I want to seek help from one or the other, oftentimes they will seek an accredited organization versus an unaccredited organization because it addresses that other piece up here with the accountability, right? It's showing that we are availing ourselves of that external group that is coming in and validating that this particular program is a high quality program. So accreditation supports through all of the things that we look at: innovation, empowerment of the individual, as well as empowerment of the program to be able to evolve. It improves productivity generally. And one of the things that we prompt is data-driven decision-making and performance measurement or outcomes measurement around what happens to people when they come into a particular program. What's typically the result that happens? So before I maybe move into this particular slide, were there any questions that needed to be answered at this point? Mark or Zep?
In looking at the chat box, do we have any questions in our chat? I'm asking my monitors.
Not yet?
Yeah, not yet. No questions
Okay.
thus far.
All right.
Thank you.
So this particular slide, it's kind of an interesting set of data, right? So CARF as an organization, we can only compare conformance to standards within our own system, right? So we can't know how unaccredited organizations that we don't have any connection to perform. But what this slide is seeking to show is that within organizations that are, again, licensed, that operate, that probably are providing services day in and day out, we are comparing what happens to organizations that get accredited in these particular business areas versus organizations that wind up not getting accredited, right? That they've applied for accreditation to CARF and they had a non-accreditation decision. They had an outcome that resulted in them not getting accredited. And you'll see that there's a significant drop-off in each of the areas, whether that's strategic planning, whether that's financial planning and management, managing risks, health and safety, in the human resources areas, and in performance improvement. There's a significant decrease in the difference between an organization that is accredited and an organization that's not accredited. So within that, even if you were to say that organizations that receive a non-accreditation decision here, if an organization is not prepared when they are seeking accreditation, you're going to see these wide gaps of overall conformance to the standards, and those that conformance is effectively like a proxy measure for overall quality and management in the organization. So that big drop is fairly significant, and that is something that you can see that it does drive different changes in the organization through the course of time. And then over time, there are a number of changes. We did like a 10-year study looking at what happens to organizations that we accredit. So when we look at organizations from their first survey to their latest survey, and so organizations are in a whole lot of different places in that, obviously, but some of the things that you can tease out of our data shows that there's a 26% increase in persons served annually, which means that they're more efficient at being able to deliver services over time as they get greater and greater adoption to the particular standards. There's a 37% increase in conformance to quality standards, meaning that as time goes on, they get better and better at demonstrating their overall conformance to standards. So when an organization first gets accredited, they may have a lot of areas where they still are not fully in conformance with standards, but over time, there's nearly a 40% increase in that conformance. And then there's also, and I'm sure many of you are interested in this, a 37% increase in annual budgeted dollars. So when we go back and look, there is increase in budget, and that can often be attributed to things like access to new funding streams that may not have been available prior to being accredited, as well as, again, some of the activities that we ask you to do in terms of things like evolving in your areas of leadership and strategic planning. That helps you to sort of seek new opportunities for perhaps new grant funds, et cetera. So there's a pretty measurable change that happens to organizations over time as they are accredited versus when they prior to having been accredited. So there's also a two-thirds of organizations that are accredited expanded services to persons served annually by 26%, which obviously also results in sort of budget expansion too, right? If you're providing more services to more people, you're usually going to bill for more services and generate more revenue as an organization. 2/3 of the organizations increased personnel by a total of 53%, meaning that these organizations grew, again, in this 10-year impact study that we did looking at our organizations. 2/3 improved standards conformance by 37%, which I already addressed. 3/4 increased their annual budget by 26%. Okay, so organizations report to us that their involvement with CARF has improved their performance in all of these areas, right? So we survey organizations after we do a accreditation survey with them, and they tell us that their documentation of their policies and procedures significantly improved as a result of participating in an accreditation. Their performance improvement practices significantly improved, delivery of quality services, health and safety, risk management. And then the thing that we are most proud of is the improvement in person-centered approaches to delivering care. We certainly believe that the person that's being served by the program is really, it should be the focal point of how care is conceived and delivered. And so we certainly value the fact that they're able to report back to us that they've seen a significant improvement in their person-centered approaches as an organization. When I talk about the standards, and I could probably talk about this particular process for a long time. It's probably not the most significant thing for you to have interest in, but this is our kind of a graphic of how we develop standards. We don't sit at CARF and just simply decide, well, we're going to sit here and write these standards. We get input from the field that tells us through a variety of mechanisms the things that we need to be attending to. And then once we have determined that there are changes or improvements that need to be made to our standards, we pull together expert panels that represent a cross-section of people in the field and always represents persons with lived experience, persons that are served in program areas that are a part of that expert panel. And then we do field reviews. We have this International Advisory Council, which is a group of organizations that are affiliated with CARF that really kind of get the first crack, if you will, at being able to give some feedback to CARF about significant standards changes. We'll take that under advisement, and then ultimately we go to a broad field review. When we make changes, when we make significant changes to our standards and we put that out to the field, we ask for and typically get quite a bit of feedback about changes to the standards. And we look for a high level of consensus that these standards are representing and reflective of quality. Typically, if a new standard that we are seeking to implement has less than 90% consensus that that's a good standard, it typically doesn't make its way into the standards manual. Now I say typically because there may be some exceptions to that. If there is people might not like it, but sometimes there's a regulatory purpose for a particular standard. But for the most part, we get very high consensus around standards changes. And in fact, in 2020, we completely rewrote all of our standards around crisis stabilization unit standards. And quite frankly, the field was very pleased with the changes that were in those standards, and all of the proposed changes were well in excess of 90% consensus that they were reflecting quality. So the way we think about all of our standards is we look at the business processes of organizations, right? And business processes are in a variety of different areas, right? Around technology and legal and regulatory functions and HR, measuring performance. And leadership drives that to look at the programmatic activities that happen, like the actual functions of programs, and all of that is representative of overall quality in an organization that delivers value to individuals being served, like service access, effectiveness of the services, efficiency of those services, and satisfaction as a result. Just as an example of information that's come to us via our surveys, we look at accreditation as an ongoing process, not an event. And we have an individual that shared with us, that they're in a survey that they thought that accreditation is reflective of really an ongoing performance improvement perspective and philosophy as an organization. Another is, what you gain from the process. It really helps you to have discipline to a process of developing data collection tools that's used to improve and enhance your overall programs. So as I talk about standards, right, I say that over and over again. How are they organized? What's the framework for standards? And we have our business practice standards organized into a standardized framework that we call Aspire to Excellence. And you see the functions there, like assessing the environment, setting strategy, person served and other stakeholders, obtain input from them, implement the plan, review results, and affect change. These are all of the functions that you have in your business activities in the organization sort of fit under one of these particular letters in that Aspire framework. And this is what that looks like, right? In Assess the Environment, we have standards around leadership and governance. In the areas of leadership, we're really talking about how does top-level leadership function as in the organization? How do they demonstrate that they are meeting their responsibilities both to the organization and to the individuals being served? Governance is something that is typically a voluntary application. So organizations that apply for accreditation can either choose to have governance applied or not. In order to have the governance applied, you even have to be eligible, which is typically meaning that you have a governing board that has, a governing and fiduciary responsibility to the organization. So there are typically going to be not-for-profit organizations that have governing bodies. There's other examples of that too, but typically privately held or for-profit organizations don't have a governing board, and so the governance standards wouldn't apply to them. Then in set strategy, we have strategic planning, and we have a number of standards around how does strategic planning happen and who's included in that process, and how do you share the results of your strategic planning with persons served and other stakeholders. Then we have a group of standards around how you should seek input from persons served and other stakeholders. We expect that leadership is going to listen to the voices of individuals being served about how services should be designed and implemented. What kinds of things can the organization do to improve the way that they serve individuals that are participating or service utilizers of the program. Then we have sort of implement the plan, which is in many ways kind of the core functions of business practices. So things like legal requirements. Are you operating legally according to the regulations in your particular area? Financial planning and management around sort of budgeting and financial reporting functions. Risk management. What kinds of activities are you planning for implementing and mitigating risks to the organization? I don't know why that legal requirements is there twice. I didn't notice that before. Apologize for that error. Then we have financial planning and management. Why is that it's all duplicated? Oh, well. Anyway, let's go down to health and safety, where this is activities that are designed to ensure that the environment of care that you are participating in is protecting the health and safety of both persons served and personnel working in the organization. Workforce development and management are all of our standards around HR kinds of functions, background checks and credentialing for your organization. Technology is around, technology is something that, quite frankly, you can't avoid, and particularly in the last year, right? We've all had to even sort of repurpose the way that we thought of technology for delivering care in many cases. But how are we thinking about technology and adapting technology for the use of our staff and the individuals that we serve? Rights, and this is just, of course, standards that protect the rights of individuals being served, and then accessibility. How do you ensure that you are making your program accessible to the right people at the right time and as seamlessly as possible? And then the review results and affect change really is two groups of standards around how are you setting targets for your performance as an organization, collecting data that is focused on the outcomes for persons served, and then what do you do with those results and they affect change, performance improvement area. So the first part is, what data should we be gathering to measure outcomes, and what was that result, and then what are we doing with that? How are we getting better over time? And so all of these discrete areas is that Aspire to Excellence framework, which is designed to improve business performance and business practices of the organization over time. Then we switch into the clinical program areas, and the section 2 of our standards manual is what we call general program standards. And the easiest way to think about these standards is these are the standards that apply to all of the core programs that an organization would be seeking accreditation under, and it'll make sense to you a little bit better in a moment. So if you think about clinical practice, right? You have clinical administration functions, and that's really what I think the program service and structure is. It's, how are you organized? How do you ensure that staff are appropriately trained and that they are able to deliver the services that you intend to deliver? And then there's maybe the core of many treatment services, right? Screening and access is around screening, assessment, and orientation to services. Person-centered plan is the treatment planning function. Transition and discharge is, how do you prepare a person for completion of a program or transition into another one? Then we have things like medication use standards. Promoting nonviolent practices would be those standards around potentially protecting the individuals and with seclusion and or restraint. Quite frankly, we know that these functions still happen in behavioral health. We don't promote the use of seclusion or restraint. In fact, we insist that organizations that do use seclusion or restraint have a plan for how they're going to eliminate the use of all seclusion and restraint in all of their program areas, but we recognize that they may not be there yet. And so we have standards about if you are going to do it, how is that going to be managed? Records, of course, clinical documentation is a critical part of all of the work that we do. And so we have standards around how those records are managed. And then this quality records management is really a function of quality reviews, peer reviews of that, and documenting your peer review processes and utilizing those results for performance improvement. So again, instead of having to, if you think about all the different program areas that we might accredit in, so you think about things like outpatient treatment, residential treatment, case management, detox or withdrawal management programs, et cetera, et cetera, et cetera. All of those programs do things like screening and assessment and orientation and treatment planning and so on. So instead of duplicating those standards over and over and over again, they all live in section 2. And then in sections 3 and 4, there's only standards that are related to the execution of those particular programs. So in section 3, core treatment programs, these are all of the different program areas that CARF can accredit a program, accredit in an organization, sorry. And so there's a lot of them. I'm not going to read them all, but you can probably find something that's pretty close to a program that you might offer services in. And then we also have what we call core support programs in section 4, things like assessment and referral and housing, comprehensive suicide prevention programs, crisis information and call centers, et cetera. So the way that CARF thinks about accreditation is through the program. So you would find the program that you either in section 3 or in section 4 that you offer that you would like to get accredited. And then all of the standards in section 1, being the business practices, are applied. All of the standards in section 2 are applied. And then the standards in sections 3 or 4 would be applied. So all of that in concert is what you would go through in order to be able to become accredited as an organization with CARF. Lastly, we have specific population designations. So let's say that you are an outpatient program that serves children and adolescents. Those standards would also be applied to the organization. So Section 1 standards, Section 2 standards, outpatient standards in Section 3, and then children and adolescent standards in Section 5 would also be applied. So it is all of these standards that are put together that you get feedback on as an organization that ultimately is going to be able to demonstrate quality to the community. So before I start talking about quickly the process, again, I'll take a break if there are any questions that need to be answered at this point.
There are currently no questions in the chat box, but if you guys would like to take yourselves off of mute as well, please feel free, and you can ask Michael some questions.
Hearing none?
Hearing none.
Keep on going. So, you know, I keep talking about, you know, sort of accreditation in the abstract here, I think, right? That talk about that it's this quality improvement function, but what does an organization do? Like, how does an organization get to a place where they are not accredited to becoming accredited? I think about this as just being a project, right? This is something that you set as an organizational goal and you implement activities to try to get there. The first thing that a company or an organization can do is contact CARF. And we have resource specialists that are here that work every day, that are effectively your sort of customer advocate. They can answer any questions that you may have around standards and interpretation and implementation of standards and the process and everything else. And usually people will talk with us about a year or so out from their target date of wanting to become accredited. And then you start doing some self-evaluation. I would say, you know, we say that at a minimum that should be, you know, 6 to 9 months in advance, but it should probably be done more like 9 to 12 months in advance, because you want to give yourself plenty of time to be able to make changes in order to conform more with the standards. Once you've kind of reached a point where you feel like, okay, we understand the standards, we have looked at ourselves, we've made changes to our practices, perhaps our clinical documentation forms, our policies and procedures, we think we're getting close to being ready for a survey. About 6 months out, you would submit an application. So we effectively, we answer any questions that you would have. We try to assist you with education, and we offer education opportunities to organizations around the standards, but it's your organization's responsibility to get ready for a survey. I mean, at the end of the day, when we come on site, you're going to demonstrate to CARF that you are in conformance with the standards. You'll fill out the application, you'll tell us what programs you want to get accredited, where they're located and everything else, and based on that, based on the number of locations that you have, the number of programs, the distances, all of those sorts of things, CARF determines how many surveyors is going to be needed, and there is a survey fee that is invoiced. Now, there's really only 2 things that CARF charges for. One is that application, and that application is the fee is the same for everyone. It is $995. And then there's a survey fee. So there's a per surveyor day fee. It's going to be $17.50 or $17.80 per surveyor day. And so that is how CARF essentially is paid for. There aren't any other fees after that. A survey team is selected. You get notified about who is on the survey. The survey is conducted, and then about 6 to 8 weeks after the survey, an accreditation decision is rendered. There are a couple of different things that could happen. Typically, an organization is going to either get a 1-year accreditation, a 3-year accreditation, or non-accreditation. And those are the typical decisions. There's one other difference. If you, let's say that you have to have a preliminary accreditation where you may seek an accreditation before you open and before you're operating, you can get a 6-month you can get a 6-month accreditation, and we come back and review in 6 months when you've opened and are operating to ensure that you are meeting the standards, and then you would get sort of the full outcome, either that 1 or 3 year. After the accreditation decision is rendered, you submit to us a quality improvement plan, because chances are you won't have been in conformance with all of the standards. So you'll need to respond to those areas of non-conformance. And then every year for 3-year accredited organizations, you'll complete what we call an annual conformance to quality report. And, you know, just a sort of an assurance to us that you are continuing to monitor your progress to the implementation of the standards in your organization.
And Michael,
So,
we do have a question in the chat box. A question, is the $17.50 per day or per surveyor per day?
It's per surveyor per day.
Thank
So if
you.
you had 2 surveyors for 2 days, which is a common survey, it would be 4 surveyors, so 4 days, 4 surveyor days, and that's the total. There aren't any additional fees for like travel or anything. That's all included. So the surveyors coming and being on site and doing all of their work, and everything is included in that fee. Okay. So, you know, sort of pay attention to your capabilities when it comes to setting your timeframes and the design of your tactics. What I mean by that is you should keep yourself working, but don't set targets that are too fast for you to be able to implement. Like, you should make sure that you are able to deliberately implement all of the activities that are designed to help you to be successful, because what you don't want is to have a survey where you're not prepared and you get an outcome that you don't want, right? You want to make sure that you have done a good job of getting yourself ready. Now, sometimes the inertia is we keep putting it off and putting it off and putting it off. I think that's problematic too, right? I think you have to set a target date that you hold yourself accountable to. But what I really think is important is don't set it for like 3 months from now. Really give yourself that 9 to 12 months to be able to fully get all of those activities implemented in your organization. Be sure that you take a team approach. This isn't something that you assign to one person in the organization and say it's your responsibility to get us accredited, because it's going to cross all sorts of business lines and activities in your organization. And please make sure that you take that team approach rather than giving it to a person. Okay. I was talking about the resource specialists. You'll have this slide. This tells you who the resource specialists are by location, so that you'll be able to have direct contact information with the individual who would be representing you with CARF. And just as a, you know, sometimes it's funny because sometimes people go, oh, who's CARF? We don't know CARF, or we haven't heard of CARF. We have a fairly large footprint as an organization. There are over 14 million people being served in CARF accredited organizations every year. There's over 61,000 programs that are accredited by 8,000 service providers in 26,000 locations around the world. We accredit in about 26 different countries in 5 continents right now. So we aren't just a United States or North American company. So to sort of summarize, accreditation is evidence that your organization is seeking to improve itself and to demonstrate quality to consumers, to individuals being served, and to the community. There are a variety of values that CARF may offer to you, but mostly assuring to persons served, payers, and their families that you're focused on their unique needs, that you're focused on quality, and wanting to assure that. Be sure that you're looking at all of the accreditation options, and that's why I try not to talk exclusively. You know, I try to talk about accreditation in general as opposed to just CARF, because you do have choices. You should pick the accrediting body that is the best fit for you, that has the best standards that represent sort of your philosophy and your culture as an organization. You should develop a work plan that helps you to track your progress. I think about this is, again, it's a project plan to help you to prepare and implement the standards, use that team approach, conduct that self-assessment. And hopefully you'll find that ultimately accreditation is more than just a certificate on the wall, but that you actually see improvement in the organization. I've had organizations on many, many occasions over the years tell me that, you know, we thought we were a good organization. We thought we were doing things well, and we didn't realize how much better we would get once we implemented an accreditation initiative in the organization. And I think if you call any of our accredited organizations, you'll probably find that they'll tell you that they have value on it more so than just the certificate on the wall. So any questions? I know that I saw one question flash around training. We are looking at having some in-person training where we think that we're getting to a place where we can actually maybe leave our homes again, right? And so we are thinking that probably in the fall, we're going to be delivering face-to-face training again. We'll of course have to pay attention to how we do that safely, but we do think that we're going to be able to do that. And I certainly am looking forward to that day and we can get back out. So thanks so much, and turn it over to Dustin, or at this point, if there aren't any other questions.
Thank you so much, Michael. Really information-filled presentation, very helpful. I'm going to quickly pass the baton to Dustin Richardson to bring us to a close. Dustin, it's on you now.
Thank you, Mark. And thank you, folks from Nikui, first off, for having us and for inviting me. Thank you, Mark, for that wonderful introduction. And thank you, Michael. I think you did a great job of really giving a lot of information about what the accreditation process is like. So again, don't need to introduce myself. Already did a wonderful job of that, Mark. But essentially, you know, I've been through the accreditation process with actually now about 5 agencies over about 7 times now. Lifelines, we've gone through the accreditation process twice. And so I'm just here to try to give some information on what that is like as a UIO, and just kind of give that perspective. Now, given I've been through CARF a lot, I don't work for CARF, I'm not getting paid. You know, I'm really just here as somebody who's just given some information. And even with Maryland, as actually Michael mentioned, which is one of the sites where Lifelines operates, really the accreditation is required, and that's really why I've been through it so many times. But there are other organizations that you can get that accreditation from through the state of Maryland, but you know, CARF has tended to be one of the big ones preferred, honestly, just because they do offer a good quality of service, you know, especially as you look at the other accreditation bodies. So I'm going to go ahead and just start. So some of this stuff I'm going to move through because Michael has already covered really what is CARF. And even, you know, the reasons to be licensed and accredited, I would say the main thing that I'll highlight in terms of CARF accreditation. So Maryland moved really to an accreditation standard, trying to make a lot of the work that they were doing in terms of their state audits easier. It really does actually help out the state to have a standard of care that they're really evaluating. And so a lot of states are, you know, they're likely to look at some of these standards of care. And I would even, you know, wherever your UIO operates, depending on how especially your billing works, even though you may be working primarily for Indian Health Services as a, you know, your major funder, if you're still doing billable services for medical assistance, accreditation may really help you with getting your licensure. And I think we're going to be seeing a lot more states that take on an accreditation standard just because it's really helpful for evaluating standards of care. I think that actually will really come into play for telehealth services, probably in the next 3 to 5 years, maybe sooner. But another really good reason, you know, to do accreditation is really to have a much better standard of care. I really do think that CARF helps you be a better organization, both to your community, to your staff, and even to, I would say, like IHS as a whole. I think that it is quite valuable And even there are some kind of nuts and bolts values to it. So one thing that I'll mention that I think is really great, if you are an accredited agency or organization, you can request a abbreviated site visit from IHS. Most of us are familiar that, you know, IHS is typically going to have an annual review with a site visit. Right now, they've probably been switching to virtual site visits. I know our local area office did. These take a lot of time, and certainly not complaining about it. But having an abbreviated visit is sometimes the difference between having, you know, 3 days, 4 days of a site review with, you know, maybe anywhere between 3 to 5 people from your local area office or more, to having maybe, you know, 1 to 2 people come down or even do kind of a virtual visit. It makes the time with IHS much more relaxed because they're able really to spend the time getting to know you and your staff rather than kind of buried in policies and procedures. And that is super valuable, I think, sometimes just to, you know, have really good relationships and also get to talk about things that you normally wouldn't. The other big thing that I think Michael did a great job of talking about is really managing organizational risks. I feel like UIOs operate in a field where there are a lot of intersections, there's a lot of risk, there's a lot of burnout. You know, there's just not enough resource for the job that is often done. And so having someone outside who really takes like a supportive role, I think is wonderful for helping you kind of manage your risk and also like get some support. I'm not going to talk about the accreditation process. I think Michael did a great job. Really, the main thing I'll highlight is just time. Give yourselves time for the accreditation process. And even to Michael's point, try to have a team approach. Realistically, sometimes I do feel like CARF gets put primarily on one person, especially with under funded and overwhelmed agencies. And I know UIOs will often fall underneath that category. So even if you are kind of, we'll say the main facilitator, make sure that you're giving yourself enough time and that you're coordinating with the people you need to coordinate, which is primarily, especially going to be people within your board of directors, your executive director, anybody who's really within the fiscal department, and then whatever is kind of HR for your organization, because there's going to be a lot of collaboration that you're going to need to make sure even that you have everything together to then show the folks as they do their survey. Accreditation costs. So this is slightly lower than what Michael talked about. Right now, I base this off of the original rates when we had budgeted for the accreditation. And then also right now they're doing virtual site visits, and that's impacted the cost. And I see Michael nodding, so that's good. But, you know, long story short, we actually got a little bit of a refund because they weren't able to do the in-person visit, which was, you know, certainly helpful. And but normally, you know, that survey fee, it does, you know, track for their hotel, their per diem, for their travel. So most of the time, you know, for organizations that I think are UIOs, it'll probably be 2 surveyors for 2 days. And I know that sometimes not knowing that might make budgeting a little bit tricky, but most of the time the cost is not super high compared to a lot of the things that you budget within a standard like IHS contract, or even if you're taking that money from another grant source. The site visit itself, you know, really is really what you're prepping for. That's really game day. You know, really kind of knowing that it's going to take a fair amount of your time. Now, CARF normally does a pretty good job of trying not to interfere with your day-to-day operations. And really, like, you know, during previous site visits, like, you know, I'm still a clinician, I still see clients, I still do clinical supervision with the people that I supervise. And, you know, like, I'll still have meetings, but I will definitely dock, you know, like 80 to 90% of my day really for CARF. because just being readily available for a surveyor is super helpful if they can't find something, or if they're looking for a little bit of clarification on something. It is going to be really important that your staff is kind of on deck for that as well. And especially like just making sure some simple things happen, like, looking at your office space, making sure that, some simple things like fire extinguishers and exits and escape routes are well marked. But also just making sure the place, looks its best. Sometimes we can put things on the back burner if they're not a raging fire. And I feel like over the last year, I've dealt with a lot of fires. Dealt with 2 this morning so far, and we'll see if we make it to 3 before I leave today. And so I think you can forget these things, but just even assigning some simple tasks like that to more administrative staff can make your life a lot easier, and also can make the accreditation just go better. You're really trying to put your best foot forward. Also, just let some key staff know that they'll probably have conversations with CARF. CARF also usually speaks with a few of your clients or consumers from whatever program that they're accrediting. This can be important, especially during COVID, because some programs haven't been operating in the same way. For example, we normally have a youth and families program that operates on site, and instead we've really switched to virtual events. And we had a former accreditations really for what was kind of outpatient psychiatric treatment for youth and adolescents, but we really haven't been doing it since COVID, because it really hasn't been safe to do it. So, take that in mind, that, there might be, some changes in your policies and your procedures that you haven't thought about, especially due to COVID. And that may impact the accreditation process as well. Besides that, I'll talk a little bit about virtual site visits now, and Michael can probably talk about this. I don't know how much longer CARF will be doing virtual site visits, and I don't think CARF knows, and Michael, feel free to pipe up if you happen to know.
Well, I actually don't know the answer to that. We're meeting next Friday to kind of determine our plan for return to on-site visits. And so I don't really know when that's going to be yet. It's complicated.
Yeah, and I think that's the difficult thing with COVID. There's a lot of planning, and I think, CARF has done a very good job of trying to plan for something that changes almost daily. And, the difficult thing with COVID, and especially for accreditation agencies in general, is they start their planning, like a year out. And as an agency, our accreditation, when we originally applied and did the application, should have been really in July or August. And we really didn't end up having it until March, the very start of March, due to COVID, because of just issues of a backlog, and then having to make it, I would assume, a lot of decisions on CARF's behalf for how they would do a virtual site visit to the same degree that they're doing in person. I know one of the surveyors that had done our visit talked about whether or not CARF would have virtual site visits as an option for organizations in the future. I'm not sure. I'm betting Michael probably doesn't know either. But, long story short, if you already are in the accreditation process and are going to be having a virtual site visit, I just wanted to include a few things. One, everything was facilitated via Microsoft Teams. If you haven't used any kind of cloud-based systems that share documentation, Teams, I would say, it's fairly usable. Some people have used things like Slack. A lot of people are familiar with using like OneDrive or Google Drive. But it's really a way where you can share a ton of information fairly fluidly. Now, for site visits, I do recommend that people get really the survey preparation manual. It usually makes your life a lot easier, because it, as Michael's talking, like, there are so many standards and it gets really complicated, but the prep books normally kind of go through line by line what you need to have. And it can be very simple to kind of organize everything. Normally when I have an in-person visit, I'll have a couple big binders together that will have all of our policies and procedures, and I'll have things bookmarked and tabbed out for where each accreditation standard is. So it's much easier for the surveyor to kind of look through everything and go, okay, I see, you know, your general practice on restraints and seclusion right here. You say you don't do it. All right, okay, meets that standard. Or as you're going through on cultural competency, okay, here's your cultural competency plan. I can see where it meets the standards. Okay. For the virtual site visit, the challenge can become, you may have your policies and procedures in a 30-page document, but to make it easy for them, you know, what they requested is have each section kind of bumped out as an individual document. And so like you may end up taking these big manuals and kind of digesting them and breaking them out so it's easier for them to find everything. It takes a lot of time. The good thing is you can have multiple people upload documents to these drives at the same time. So that's really benefits you if you have, you know, some assistance. The only problem can sometimes be, or at least what we found is people can start to overlap on documentation. So really we ended up only having one person, who was myself, like doing that uploading process, just not to get confused with documentation. Generally, I feel like trying to organize who's doing what with CARF is really helpful. Long story short, it sometimes isn't always as fluid as we would like it to be at small organizations. But even the site visit itself was given via Teams. So really Teams also functions as basically like a virtual communication platform in the same way that Zoom or Skype does. And literally I had an iPad and I walked around our facility from, you know, basically street level from the parking all the way through the building and whatnot, just so that they can see both the building, how to access everything, making sure that, you know, you have things like ADA compliance, you know, making sure that folks who are having a wheelchair or whatnot can get in a building. And besides that, you know, I think it is harder to sometimes feel connected to people, you know, over virtual environments. You know, the virtual site visit, like I've been through in person and I've been through obviously a virtual site visit now. If I would have had a choice, I would have preferred an in person, just because you tend to get like a better feel for the surveyors. You tend to have, I would say, just better rapport with people. Not that we had bad rapport and not that it was, you know, bad experience, but, you know, I just enjoy, I think, being with people. And especially, I think, like as a Native organization, it's nice to be together and be able to gift people things and kind of like welcome them in. And you're not able to do that to the same degree that you would, I think, for an in-person visit. Let's see. Now for outcomes, you know, you'll get a lot of feedback. You know, the formal review will come between 6 to 8 weeks after. The nice thing is you'll likely just get some informal feedback from the surveyors. This isn't usually like, okay, you're definitely going to be accredited for 3 years. This is normally like, you know, you guys did good on this and this. These are some things that we would like to see. You generally know some of the things that you don't have after the visit. And once you get that formal visit, one, I think it's a good thing to share with whoever is, you know, your primary consultant or connection to your local area office. I think it's very helpful for them to see, because usually CARF does a really good job of highlighting the things that your program is doing well and the things that they're impressed by. And they generally take, as a clinician, what I find is like a strength-based perspective. So looking at what's working over really what's not. And, you know, really, I think it's helpful to get outside opinions of how your agency is doing, especially with IHS, even to help advocate for yourself. And also even just to, you know, look at some large scale planning towards the future, and especially like where things could work in terms of increased funding or increase like program deliverables. You will be expected to make feedback once you get, or sorry, changes, once you get their formal recommendations. And, you know, as Michael was talking about, you want to make sure if you are having major changes to your program or agency, you're letting them know. For example, our site moves from one building to another, you know, so that was something that I included in updates to CARF. Even, you know, things that change in terms of your funding. We had gotten a Form 1 grant, so that increased our staffing. So that was just something that, you know, you can consult CARF about. The nice thing about CARF is if you do also need examples of policies and procedures, you can reach out and contact them and just, you know, try to get some input. And even after your survey, you'll generally get from your surveyor. So if you don't have, for like an example of a disaster plan, they are usually going to provide it to you even before your site visit ends, and just kind of say like, here's kind of what we're looking for, but here's also something that, you know, you can kind of use to better understand what might be helpful for your organization. Again, the accreditation length is usually going to go 6 months, a year, 3 years. The 3-year accreditation is obviously what everybody hopes for. Now, the good thing also about getting a 3-year accreditation, besides the fact that you don't have to go through this process as many times, and also the cost, is for IHS, that means for 3 years you can do an abbreviated site visit. And that is very, very helpful in terms of like your organization and just, you know, we often do a lot with a little. And I think, you know, having some things that take a little bit less time are just super valuable. And especially when you get really good quality feedback like you will with CARF, and really like kind of keep those standards up. And so for covering costs, you know, I'm a smaller, or you know, really Lifelines is a smaller nonprofit and a smaller organization. So, you know, even a couple $1,000 definitely can make a difference. But a lot of grants will cover first-time accreditation as well as ongoing accreditation. A lot of core service agencies will actually cover the cost for providers. Originally, that's actually how Lifelines was able to get funding. We were able to get funding across a couple programs, and I think that's also something to consider. Like accreditation for multiple programs usually requires a longer site visit and more surveyors, and so, you know, you just have to consider that as well. But, you know, it is very doable. IHS usually also sees this as an allowable cost in my experience. I can't speak for other UIOs or for other local area offices, but Nashville has typically found it as critical to the functioning of the agency. So you can normally ask for assistance from IHS. Some recommendations. Without too much, you know, I would say make sure that you have a lot of your key information in one place. You know, CARF, along with, very similar to like an IHS site review, will show you how well you are organized just in your files, across, you know, your leadership, even with your board of directors. You know, understanding how your work is flowing internally, I think, is really important. And CARF kind of gave you a moment to reflect of, can I find where all of our files are, where all of our meeting minutes are, where all of the board of directors notes are, and even how do we share that information across an agency. But I think especially knowing things like making sure you know your federal tax ID, you know, understanding how many people you're actually trying to have surveyed, or and especially how many people are going to be served by the program seeking accreditation. And I think sometimes that's difficult depending on what EHR system you're using, even, you know, what pieces of RPMS you have access to, because of a lot of, I know for, you know, our clients, they may be coming to us for case management, but if we're being accredited for outpatient mental health treatment, which is really for counseling, how do we look at what folks are going to what specific programs? I would also say, you know, try to have some, you normally have to have at least 2 external like funder references. And these are usually people who work with your organization. We typically have used IHS as one of them. We've actually used Nikui at times as another. And they're just folks who can kind of speak well about you and especially speak well about your ability to handle funds. Besides that, any outcome system used. So this is a good time to have any of your data present, any of the things that you do for client feedback, any of your deliverables, or like I know I try to send a monthly report to our local area consultant. I typically try to have those available. And I usually do like a yearly kind of performance review that goes along with the GIPR reporting and workload report. And those are really valuable things to just kind of have available for them. Especially also looking at any demographic or statistical data is really appreciated. Make sure you know how many like full-time employees, and I think if you're an organization like Lifelines, there's been a lot of growth. I've seen actually a lot of organizations grow during COVID, which is excellent. But sometimes it can raise the question of how many like full-time employees do you have, how many folks are contracting for you, how many interns and externs do you have. So making sure that you have good understanding of that, and even especially how many direct service folks you have. This is employees, contractors, and volunteers. Yeah, so there's a lot, that's some stuff I would highlight together, but that's not everything. A few recommendations. So again, start early. Really do try to follow that timeline that CARF gives you. It is very helpful. Try to not only buy the manual, well, actually you're going to need to buy the manual, period. You can't follow the accreditation standards if you don't know what they are. Budget for that cost, but I would also say budget for the workbook. If your money's really, really tight, you can look at Appendix A in the manual, but I think the survey workbook just does a better job of it. You can hire someone to actually help you with the CARF accreditation and go through the planning and the policies and whatnot. In Maryland, it costs a lot depending on the size of your organization, to making sure that you're going through, because usually they might do it as a wrap where they help you with the accreditation process, they help you with the licensure. And especially for larger organizations, I mean, on the small end, I've seen maybe somebody get charged maybe 3 to 4K, but they really didn't do that good of a job. Usually I would say at minimum, it's closer to 7 is what I've seen. Given these are usually with slightly larger organizations than like what Lifelines currently is, but it is something that does take a fair amount of time and energy. For me, it was at least within the last month prior to the accreditation. It took about 35 work hours just to make sure that everything was going well. And that's just really the month prior to accreditation. And some of that's also learning more about the virtual site visit, but it is a time-intensive activity. And then finally, get help from your board. This is, I think, a great time. Like, I think a lot of UIOs, their leadership can be really overwhelmed. I think drawing upon your board of directors, and especially your board understanding that probably some policies and procedures are going to need to be looked at prior to CARF and approved, and doing that in a timely way, I think is really, really valuable. If there's a policy committee or a QA committee, I think these are really good places where you can workshop and figure out some different policies and procedures. And I think all that would make things much easier for anybody doing the accreditation. The site visit, mainly you want to brief your staff. Make sure people put on their best faces and make sure that they're warm and welcoming. You don't want to, have staff kind of treat surveyors with like a mild neglect or treat them like an inconvenience. You want them to, help them. Have copies of your documentation, and this is what I talked about before. This is even on your clinical documentation, what you use for your intakes, your treatment plans, your notes, discharge planning, termination notes. lot to go into it, but at the same time, if you have it prepped, it makes such a difference the day during the surveys. Simple thing, make sure you have survey posters around the site. This is something that CARF does check for. And it's a simple thing that, helps make sure that one, your community knows that there's going to be an accreditation. And then, making sure that your staff and a reminder that it's going to happen. And then, of course, speaking with clients about the surveyors. I'm going to go ahead and stop there and see if anybody has any questions. And I'm going to give control back over to Nikui as well.
Thank you so much, Dustin. I turn to my my team of chat monitors and supporters. If we're keeping a track of the chat box, is there any are there any outstanding questions we need to bring up?
There are currently none, and please feel free to take yourselves off of mute as well if you'd like to ask a verbal conversation.
Just would direct your attention to those resources. We have a few more items that we'll work our way through in these remaining minutes, but take a moment to reflect and get your question addressed while the experts are on hand. I think if we're ready to move on, could we advance to our next slide? Now's the time for a knowledge check. Those of you, all of you who pre-registered went through knowledge checks previously, so you may recognize these questions. These are the post-knowledge check questions. We'd ask you to take a few moments to answer the items that we've inserted here quickly as an assessment of knowledge gains throughout today's afternoon. Thank you so much for the knowledge check items, and you'll see the results being shared. Look like we have a group of high performers. Again, thank you very much for sticking with us throughout the afternoon. As a reminder, don't forget the end of the session knowledge survey. If we could insert that into the chat box one more time, that would be great. The survey is important, and we want to capture your reactions to today's presentation, as well as any suggestions you may have for future topics you'd like us to tackle, or other ways in which we can improve our services, education and training in particular. Just a reminder about upcoming events. We have a session on our infection prevention control, the IPIC process, April 15th, COVID-19 and infection control. That session is currently open for registration. Our mental health sessions under our SUNY COVID efforts, a session set for April 20th is open for registration. A strength-based approach to addressing stress among urban Native youth. That's a third and final session of the mental health wellness efforts under SUNY COVID. And then our final session under the accreditation series will feature the National Committee for Quality Assurance on April 22nd. That registration is open, and the workshop will be from 1 to 2:15 p.m. Eastern Standard Time on April 22nd. That's just a teaser of coming events. And last but certainly not least, I want to alert you that we have our virtual annual gathering. It's for the second year in a row. We're gathering together, not in person, but virtually. The Circle of Resilience, Empowering Indian Country in a Virtual World is our theme for this year's annual gathering. The dates from May 25th through the 27th. The conference registration is open now and available. So I'd encourage you to take a look at our information about the program. I'm looking forward to having all of you come visit us some more virtually. So again, thank you for your time and attention. Want to be respectful of your time. It's right at 2:30 p.m. I would just point out in the chat box, there are links to the registration sessions, as well as, again, our evaluation survey, and even the link to the annual conference registration. Again, I appreciate your time and attention. I hope you've gotten a lot out of this informative session, and we'll look forward to seeing you the next time. Have a good afternoon, everyone.